This is Speaking of Pets podcast, where we give you up-to-date, accurate, science-based information when making decisions about your pet's health.
From experts in dermatology like my sister, surgery, internal medicine, CBD use in pets, the pet food industry, you name it. If it affects pets, we'll talk about it.
Today's Speaking of Pets podcast is sponsored by Blue Buffalo, the maker of natural pet foods. Love them like family, feed them like family. Blue Buffalo offers wholesome, meat-first recipes with high-quality natural ingredients in flavors dogs and cats love. Discover formulas for all breed sizes, life stages, and lifestyles. And with Blue Buffalo's True Blue Promise, that assures that real meat is the first ingredient, with no poultry byproducts, no corn, wheat, or soy, and no artificial flavors or preservatives. I'm Dr. Alice Novotny Jeromin, a board-certified veterinary dermatologist. And
I'm Janet Novotny King. I am not a board certified allergist and dermatologist, but I am Alice's sister, and I am I guess I'm the sidekick that brings it down to a human level so that you can understand what the heck she's talking about.
And she asks very good questions.
Thank you.
So I thought today we would talk about pet allergies and skin problems since spring is upon us. And yes, and the Cleveland area on pollen.com, the pollen is like 100%, which is why I had to take an antihistamine today. Yeah.
It's high here. I'm in Connecticut, and it's high. They said there were 3 trees that are blooming: oak, maple, and something else. And it's on my car. When you do the windshield wipe, it's everywhere.
I know. And the other thing is, every year they say this is going to be a bad allergy year. When hasn't it been a bad allergy year? We hear this every year. And the problem is, a lot of our pets genetically have environmental allergies. We call it atopy, A-T-O-P-Y. I can name you, I have 2 golden retrievers, both of them are allergic, Labrador retrievers, poodles, German shepherds. To be honest with you, there's probably not a breed I can think of that doesn't have some sort of environmental allergies, which again are genetic. They don't show up immediately. They will start to show up anywhere when the dog is 6 months of age up to 3 years of age.
So how do you know? How do you know when your pet's suffering?
Yeah, and a lot of people will bring their pets to me because they have runny eyes or they occasionally sneeze. That's more a trait for humans with allergy. Oh. Yeah, with dogs, and we'll talk about cats in a little bit. With dogs, anywhere the allergen enters the body, the undersides of the feet, around the mouth and muzzle, the insides of the ear flaps, and the underside of the butt, where there's not a lot of hair. So, if they're sitting in the grass or they're obviously running in the grass and then they run in, of course, what do? They lick their feet. So then they get the allergen or the pollen, if you will, around their mouth. They're rolling in the grass. So anywhere there's hair, that's kind of a protective area. But where there's not hair, you absorb the allergen across the body, goes into the bloodstream, and that's when the fun starts. Itching, licking. It gets worse as they get older. Humans tend to outgrow their allergies, but dogs and cats, for that matter, get worse as they get older. They might just start out being tree allergic, which tree pollen in Ohio is in the spring. And then the next year you'll see it's, spring and summer, then spring, summer, fall. Before you know it's all year round.
So I lived in Ohio, Connecticut, California, and when we moved to California, I developed an allergy. I never had allergies, and so did my husband, and his was to California grasses, and mine was to something called, it was a yellow acacia, which I didn't grow up with. It's a tree. And
it's a tree.
The allergist told us that it's because we weren't raised around it. So does that happen with pets? Like, say I adopt a dog from Texas and it moves to the New York metropolitan area. Would they possibly develop allergies to new allergens?
Right, because the gene for allergy is there. So, in other words, you'll start out in your place of residence by acquiring allergies to whatever, even things in the house like house dust mite, which we'll talk about, or certain grasses, trees, and weeds in your regional area.
Right.
But if, say, then you moved out to the Northeast, yeah, you're still going to be allergic. It just takes you a while to then develop those allergies there because the gene for allergy is there. Unless you can, remove the gene or do gene transplant therapy, which unfortunately we don't do in veterinary medicine, you're destined to be allergic.
So are there specific household items that are popular that,
Allergens?
yes, I couldn't,
Yes.
right.
Yeah. Well, actually, it's interesting you mentioned that because the most popular allergen, the thing that most people, dogs, and cats are allergic to, is something called house dust mite.
Ugh.
And house dust mite lives in bedding, carpet, upholstery, mattresses, fabrics, comes out at night. It's like a vampire and actually feeds on your exfoliated skin cells. So your dead cells are dropping off you all the time. Same with on dogs, same on cats. But I think what's most interesting is these house dust mites prefer the dead cells of allergic individuals over non-allergic. So not only are you dust mite allergic, but they like to feed on you more.
Ew. So can you see dust mites?
No, they are microscopic, and we all have them. When you build a new house, you won't have them. But then you have carpeting installed
Yeah.
and you start to move in your upholstery fridge. They're in the house within 3 weeks. So you can't ever get rid of them. You can reduce the number of them by vacuuming and laundering bedding in very, very hot water or hanging it out on a very dry, freezing type day. But you'll never get rid of them. You can only reduce the amount that are in your
Because I've
house.
seen those mattress covers that in the store
Hmm.
and pillow
They're
covers.
helpful.
Yeah, interesting. Wow.
But remember, I know one of your kids is allergic, and I remember you asked me about mattress covers, and I told you don't get the plastic ones because then you
It's
sweat.
hot and it's crinkly.
It's hot,
It's
right?
not, yeah, there's like a fabric, a softer one. Yeah. So,
Yeah.
okay, so your dog or cat's having an allergic reaction. Can you use over-the-counter medications like
Well,
Zyrtec
a very good question. And years ago, because I've been doing this for 30 some years, years ago I would have said yes, that all we had back then was steroid, prednisone, okay,
Mhm.
antihistamines, and as an allergist, I would allergy test the pet, find out what they're allergic to, and then just like in humans, just like in your son, put them on a desensitization shot. Well, now, come to find out, antihistamines really don't do much in allergy because we now know there's more than just histamine involved in
Mhm.
allergy. What are antihistamines? They block histamine. Histamine causes your nose to get all plugged up and your eyes to run and dogs to itch, that kind of thing. But we now know that there's so many other causes of inflammation than just histamine. So
Hmm.
it's kind of like a drop in the bucket when you just use an antihistamine.
Wow. Yeah, because the shots worked for a long time, and
Hmm.
now he's kind of outgrown it.
The thing about desensitization shots, we call it immunotherapy. Of all the therapies that we have in veterinary medicine for allergy, it's the only one that could actually cure allergy. Because the other drugs, the cytopoint, the apiquel, the atopica, the antihistamines, all treat the symptom. But the immunotherapy actually serves to block the antibodies that are causing the reaction, and over time, it quells the allergy. My technician, if you remember Jan, her dog was very mold allergic. They lived right next door to a reservoir, so it was always kind of wet, and damp in her house. And a lot of veterinary people, our own pets go without because we're always caring for everybody else. So Jan had her dog on desensitization shots for the mold allergy and forgot to renew them after a couple years. And she mentioned it to me once. She said, Pretzel, was her dog's name, Pretzel's been off those allergy shots for a couple years. I forgot to renew them. I said, well, how's Pretzel doing? Great. I said, well, then let's run with it. So, till the day Pretzel passed away, which was 15 years old, she was only on allergy shots, I think, for 4 years.
Huh.
So, not every dog is
Right.
like that, but it's what we strive for.
Well, and I know we're going to talk about cats, but we have two
Hmm.
cats, and my husband and son are allergic, but we feed them that Purina, that special
Clear.
clear, that cat food. We've talked about this before, and I swear it works. It does something because it's made a huge difference.
Yes, apparently it is for people that don't know, Purina Clear is a diet that was designed for cat owners that are
Right.
allergic. Now you don't eat the diet. The cat eats the diet,
And they love
and
it.
yes, and it neutralizes the allergen on the cat's skin. And if you look at the data from Purina, it claims that it's about 40% effective, which, think about it, 40% reduction of your allergy might be enough for you.
It works, and the cats love it. So, okay,
Yeah.
so a couple of my friends, they've called me and said, "Hey, can your sister help me out? The dog is scratching, and there's a bare spot, and da da da." And I'll say, "Well, take it and get a skin test." But they say their vet doesn't recommend it. So, what happens there? What do you do as a pet owner?
Okay, so you're right. There are, like myself, boarded allergists and veterinary dermatologists across the country that skin test, just like you're skin tested as a human for what you're allergic to. But in order for a regular vet to keep all of those in stock and all of those fresh, and there's like 50 to 80 different little needles with each pollen and dust mite in them, you need to use them regularly. So that's why it's a pretty big investment. But you can also allergy test by a blood test. And so regular vets are very capable of doing that. Now, some are a little hesitant to do it because this can be a lifelong therapy. And a lot of regular vets, general practitioners, don't feel experienced enough in guiding you through that. And let me give you an example. Remember the time you told me that your son got his desensitization shot on your way home? He's swelling and he having an allergic reaction. Yeah, throat closing up. I know what to do about that because that is kind of a normal, I mean, it doesn't happen very often. It's very rare in dogs and cats. But I think that general practitioners aren't well versed in that and they don't feel comfortable. So, we always told our clients, listen, if you give, say, zero point 0.4 cc's, say that volume this week, and that dog or cat seems itchier that week, call me. Don't go ahead and give him zero point 0.5 because you're giving him what he's allergic to.
Right.
So if zero point 0.4 made him a little itchy, think of what zero point 0.5 is going to do. So it's a very observational.
Well, and what they did was you go in every week when you start the shot there, the immunotherapy. Then you go once every 2 weeks. Then you go once a month. And what had happened that time when he had a reaction was they had changed the brand, and there must have been something else in there. But then everything was fine. They gave him the,
Mm-hmm.
what is it,
Yeah,
in the whatever it was,
the epinephrine.
epinephrine. So, and he was fine. And that happened to my husband in California when they switched brands as well too. So there's something.
Yeah, and see that's the thing. With allergy is all about immunology, which changes every day. It's a fascinating science. You as an allergist, I got familiar with one company. I happen to use Heska, love Heska, and I got familiar with their little quirks and idiosyncrasies. And you can't certainly know it all about a certain company, but when you switch companies, you don't know if the potency is the same for their allergens as the company you were using. And to go one further, when we would make a fresh vial of allergy solution for a pet owner, I would always tell them to start at half the dose because it's fresh. Things degrade as time goes on. So that could have also been a problem for you, for your husband and your son. But yeah, you have to pick the right owner to do these allergy shots for their dog or cat. Because if someone's out of town, or say, I've got a gal that has 3 toddlers, she's not going to be able to pay attention to how that dog did that week. So you really need a dedicated owner and one that has the time to observe. The best owners that do desensitization shots or immunotherapy are human patients that have allergies and have been through this as
They
well.
get it.
And also, I might add, my best clients to do a food allergy trial, because there's no blood or skin test valid to check for food allergy, are the parents of a food allergic child. They get it.
Yeah, yeah, yeah.
They get that if that dog eats 1 Cheerios, he's going to be itchy for the next 2 weeks. Or UPS gives him a milk bone, which we love our UPS guy, but when they're on special food that you're paying extra money
Yeah.
for and it's a prescription diet, you don't want to be set back 2 weeks. It takes 2 weeks to work that allergen that you're allergic to out of your system.
So, do cats and dogs have different allergies?
No, actually, dust mite is the number one.
Hmm.
It just depends. It sometimes they're just allergic to outdoor things, but I'd have to say the overwhelming majority of cats that I saw were dust mite allergic because most are indoor.
Oh, that's
When you
right.
think about it, yeah.
Oh.
And I have to tell you, we just got back from 6 months in Florida, and my little Annie, my 2-year-old Amish mill dog
Mhm.
rescue, she, toward the end there, well, my allergy and my husband's allergies were horrible. Hers was terrible.
Huh.
And now that we're here, it's 80% better. So she is allergic. Yes, she has the gene for it, and I'll probably go on and test her and start her on immunotherapy. And by the way, now, not only do we have injectable immunotherapy, we also have what's called sublingual,
Yep.
which is a little oral desensitization that you just twice a
Well,
day
that's easier.
squirt into their mouth.
Because they have that
And
for
twice a
humans
day
now.
is,
They have the drops now.
yes, they have the drops. And this is similar to that. The problem is for some clients that travel, twice a day, every day is not good for them.
Oh,
The once a week allergy shot
is easy.
is better. And I do have to tell you one thing, two funny stories. One was a chocolate lab that we didn't have the oral allergy solution then, we just had the injectable. And the owner was a gal who was so afraid of needles. We got her doing these weekly allergy shots for her chocolate lab. She went on to become a nurse.
Oh,
And then I think I told this story before of our local police
yes.
officer who had an allergic cat, and he had to give a shot once a week, and he did faint when we were showing him how to do it, and so then my Jan, my technician, would give the shot. He'd run the cat up every week, and we'd give him the shot. So yeah,
Well, we had Smudge who was diabetic, and it just became part of her day. We'd put her on the washing machine because it was our height, and you have to
yes,
make them eat at the same time, which is not always easy with the cat. But we give her that stinky wet food, and then she'd literally take her shoulders and go, "Ready? Can you put it in
yes.
behind here?" And I trained the whole family, even the kids knew how to do it because I didn't want to just have one person know how to do it. It's
Well,
not
and
help.
that's you're absolutely right. And I will tell you, cats are tons easier to give a weekly injection to under the skin than some dogs. And there's a lot of YouTube videos for
Yep.
owners to learn about how to do this. But we would be demonstrating in a cat how to give the weekly shot, and I'd be talking to the owner, and we'd give the shot, and the owner would say, "Well, when are you going to give the shot?" And I said, "Well, we just did, yeah." And so then we would have them do it,
Yeah.
so to make sure they were learning how to draw up the right amount, and so on. But yeah, I find that allergy testing and immunotherapy is very successful in dogs and cats. It's about 70% successful. However, it doesn't work right away.
No, it
So
goes
that's when
up.
we have to,
Yeah.
yes, we have to look in the dog things like Cytopoint, Apoquel, Atopica, even short acting, short term steroid, and I emphasize short acting, short term. In the cat, which we all know can be harder to give a pill,
Mm.
we have Atopica liquid, or if we do a steroid, I don't like to use the long acting injection. I like to do a short acting, say prednisolone, maybe Monday, Wednesday, Friday. But we will talk about steroids in another podcast
Mm.
because I really think some days in practice that my function was to get these pets
Oh,
off of
steroid.
steroid because you could just see the debilitating effects it had on them.
Okay, so if my pet if they're not going to present like a human with the runny nose and the itchy eye or the runny eyes, they're going to present
Right.
itching, right? And so
Yes.
much so
And
that
licking
they
and
might have
itching, licking, scooting.
okay. Oh, scooting. Okay.
And sometimes recurrent ear infections,
Hmm.
and also sometimes recurrent skin infections,
Hmm.
where they make the little crustings on the skin and
Yeah.
they're itchy.
Huh. What was I going to ask you? What was the worst allergy patient you've had? Like, what did?
Well, it was probably a friend. A friend of mine who's a veterinary surgeon at Metropolitan Veterinary Hospital,
Well,
who
let's
we haven't
narrow it
met yet.
down.
Yes. It was probably his parents' dog. He bought his parents a French bulldog. And it was when French bulldogs first started to be popular, and it was a lovely dog. It was so allergic. I used to ask Dr. Collins. It was Dr. Collins. How's your parents' dog? He'd come up to me at a fundraiser and say, "How are you?" I'm like, "How's your parents' dog?" So that one we did get under control. It was tough. And probably the worst cat I ever saw was a gold cat. A lot of gold containing cats, either gold, calicos, or tortoise shells. A lot of those gold containing cats have environmental allergies. Now, we saw other colors of cats with allergies too, but the worst one I can remember, and I'll have a picture of it on the podcast, was a gold cat that he was just so itchy. It was food and environmental. Yeah. And some pets, unfortunately, we try to get them on as few drugs as we can, and best case scenario, no drugs. But there are some animals, just I'm sure the same people, with extreme allergies that have to be maintained on medications their whole life, and okay, as long as you monitor them for their safety.
Well, are there any household products, not mites, dust mites, but like detergent or lotion or something like that? Because I know when I go to my human dermatologist and I'll have to ration, did you change detergents? Did you change your shampoo? So are there
Yeah.
things that you should use on your pet, should not use, or should not have them exposed to?
Right. That is more of a contact allergen. And yes, to be honest, let's start with cats.
Hmm.
The big one in cats, well, there's a couple of big ones. We won't talk plants. We'll do that on a different show. But things like, like the Tide Pods,
Yes.
any of those detergent pods. Oh my goodness, they will poke one of those, and then when you poke it and there's powder, you
Yeah.
inhale. So then they aspirate it into their lungs. We don't know why we like those. I think because they're poofy and they like to do that with their claws.
Wow.
Right. So pods like that, things like garlic powder. Somebody came home, found the garlic powder dumped all over the floor. It's all over the cat, and they're salivating. Garlic and onions can cause a severe anemia
Huh.
in cats, especially, and also in some dogs. So yeah, there are a lot of the big one though was when people would use flea products made for a dog on a cat. And
Oh.
let's go one further. Say you use a pyrethrin or pyrethroid based flea product on your dog.
Yeah.
Okay, you put it on
Hmm.
down their back or on behind the neck. The dog goes and lays in his cloth bed. That night, the cat went and laid in that bed.
Oh.
Next morning, the cat was trembling, shaking, and it had 104 fever.
Oh, wow.
It absorbed that pyrethrin flea product from the bed. And then, of course, cats clean
Yep.
themselves. So what's on the cat is in the cat. So yes,
Well,
there's quite a few things that contact wise, especially with cats. Cats seem to be a little more sensitive than dogs.
well, and also some cats and dogs are friendly and clean each other.
Oh, absolutely. And that's why you shouldn't use a pyrethrin based flea product on a dog when you have a cat in the household.
Oh, good to know. Okay.
Hey, did you know that for dogs and cats that could benefit from a prescription diet, Blue Buffalo offers natural veterinary diets formulated by animal nutritionists and veterinarians for certain dietary needs like kidney support, weight management, gastrointestinal support, and my particular favorite, dermatology. They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF. Contact your veterinarian about these prescription Blue Buffalo diets.
So sometimes I see dogs, including my own, and they do that butt scooting. What is that? I know it can be anal sex and all that, but what is that?
Right. Well, a couple things. You're right.
Because who
Sometimes the
doesn't like
anal
to
gland,
say anal sex?
yes. Sometimes the
Sex,
anal,
not sex.
sometimes the anal glands
Thank you.
or anal sacs
Uh-huh.
are full and they put pressure on that rectal area. And, not to be descriptive, but when you raise the tail, the anal glands are at 4 and 8 o'clock.
Yes.
So always remember that, folks, 4 and 8 o'clock. So sometimes you can actually see they're kind of bulging out, they're so full. So what I usually like to recommend is adding more fiber to the diet.
Mhm.
And a lot of people in the olden days use canned pumpkin, which is fine, but now internal medicine specialists are actually recommending Fiber One cereal. which I have my Gidget on,
Huh.
to increase the bulk of her stool. Because think about it, if the stool is bulkier, it's going to put pressure on those anal
Scoop it
glands and
out.
their little openings to then open those when they poop. Now, not all scooting is from full anal glands. Sometimes they scoot due to environmental allergies. Sometimes they scoot because they have a little yeast accumulation back there. Itchy. And you can use things like miconazole lotion. As a as a veterinarian, I put them on a little maintenance of an antifungal drug, which then they can reduce to sometimes just twice a week, and that works great. But yeah, scooting is usually allergy, anal glands, or a yeast problem. But I will say, in an older dog that's never scooted before and scoots, or you notice a change in the size of their stool, make sure you get them into your veterinarian so they can do a rectal exam, because sometimes you get tumors of those anal sacs. They're called anal sac adenocarcinoma, and they're very serious. So, any dogs and cats are very repetitious individuals. They always have a routine. Anytime they go out of their routine, that light bulb needs to go on, and you need to say, what could be going on here? Let's go see the veterinarian.
So don't, as like a pet owner like me, if she starts scooting, don't just go out and get the same ointment that you use on athlete's foot and stick it on there. Like you really need to have the doctor tell you what to do.
Yeah, you really need to see what is the problem. God forbid there's a tumor back there, and putting ointment is not going to do
No.
anything. But yeah, you need to have that looked at. And some dogs can get infected anal glands, and some can get a fissure back there where it ruptures through, and that's very painful. So yeah, that needs to be checked. Most veterinarians are well aware of that, and sometimes they'll actually infuse the anal glands with a little combination of a steroid and antibiotic, and that will do the trick as well.
Huh. So what about like I foot licking? Because I see some dogs that just constantly, 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 and
Right.
all over their feet or paws, whatever.
Yeah, and as an allergist, foot licking to me is allergy till proven otherwise. Now, there are other things like a mite called Demodex mites
Hmm.
that need to be checked in the feet. You need to check in the feet for foreign bodies. Usually, when a dog is licking all of its feet, or the front ones because they're easiest,
Yeah.
that I'll look for underlying allergy there. But if they're just licking one foot, you need to check to make sure there's not a grass on or some sort of foreign body in there. Now, there's also a difference. Are they licking the underside of the feet? Are they chewing the nail beds?
Oh.
Are the nail beds swollen? Is there discharge? But underneath the feet, when they come in from outside, if they're licking the feet, it's usually allergy proven otherwise. And whatever you do, yes, wipe off the feet, but don't soak the feet. You don't want to get the feet waterlogged,
Oh,
because
because of
waterlogged feet make you absorb that allergen, the grass allergen, the weed, the tree pollen, whatever, better. You don't want to, what we call, macerate the feet.
huh.
Like when you lay in the bathtub and you get
Yeah,
pruny if
yeah,
you
yeah.
lay
You
too
don't.
long. Well, you're compromising your skin barrier.
Right.
So if you're making those feet pruny by soaking them in water, then the dog walks around outside, inside. You can absorb better across the skin when the skin is wet. So wiping off the feet, first rinse them, pat dry, good to go. But no soaking.
Okay, so everybody knows I had Lyme disease. I didn't have a bite, never saw a bite. But if you do find a tick on your pet, now I've been
Hmm.
told a couple of things. One is I used to just pull them off our Goldens by the dozen, right?
Right.
You're not supposed to now because there's something about they let loose something that's bad, right? Where you're pulling the tick out because they've already
Yeah.
bitten the animal. So how do you recommend pulling ticks off your pets?
I just get a tweezer and do it.
Okay, that's what I've read too.
There are so many silly remedies like putting alcohol on first,
No.
putting oil on first. God forbid somebody tried putting a match
Oh
on
God.
the. I know. So I get a tweezer, and then you really should wear eye protection, because you don't want to squirt that and then get it in your eye
Right.
or in anywhere in your mucous membranes.
Hmm.
And then you need to make sure you destroy it properly.
And you got the whole thing out because
Absolutely.
they really
Yes.
get in there. And the other thing, what I usually do if I find one is I'll glove up, to be honest. Or
Yeah, I
we
agree.
come in from a walk and I can see it crawling on her muzzle, and I take a white towel, like a kitchen
Hmm.
towel, and wipe it, and then I throw it right in the hot, in the hot thing in the washer.
Hot washing
But the
machine.
reason I
Yeah.
use white is I can see if I got it.
Yeah. And same with your white socks if
And
you're out gardening.
I saw this on a site, that rolly sticky thing you use to on your clothes?
Yeah, the lint for
The
lint.
lint. The lint roller is supposed to be great for dogs and cats to roll it. It picks up the ticks if they're not in the skin.
Right. And you also have to look on the inside of the ear
Yep.
flap and between the toes.
Yes.
Generally, ticks like to go to the highest point. So I always focus on the head and ear area. The thing is, people get concerned because when they find a tick on the dog, they want it started on doxycycline right away. Most ticks, although there are exceptions, and they're finding this out on a daily basis, most ticks take 12 to 24 hours to transmit disease. Although there are some exceptions where they're now finding some diseases can be transmitted via the tick bite within an hour. But if you have your dog on a good oral or topical tick preventative, like Vectra 3D is a topical, orals are Simparica, Brevecto, NexGard, Credilio, which I know you use. That's the best protection you can do.
And I have found them dead on Libby's fur, like completely
Great.
intact because it's repelled the
Well, yeah, it doesn't repel them, but it doesn't it kills them before they have a chance to transmit
yeah.
disease. That's the whole ball game, right?
Now we here can send them off to the state for testing.
Most county health departments you can do
Yeah,
that.
we send you put it
Yeah,
in
I
a
know.
cotton ball in a Ziploc, and then you write
Yeah.
your name on it, and then you send it off, and they
Hmm.
send you the report back. It's actually
Yeah,
pretty
and the
cool.
advantage to that is there, certain ticks um, carry certain diseases.
Hmm.
So, that's kind of interesting to know.
Okay, so what about ear infections?
Ear infections, right. Ear infections, people think, oh, the dog went swimming, so now he's going to get an ear infection. Most of the time, ear infections, when a tumor isn't involved, God forbid, okay, which is pretty rare,
Hmm.
most of the time, recurrent ear infections are due to either underlying environmental allergy or underlying food allergy. And you can have both, which is interesting to me. There are things that cross react. Okay, grasses and grains cross react. House dust mite and shellfish. If you're shellfish allergic, you may be house dust mite allergic. So let's see, mangoes and walnuts. Whoever knew those were related? So the thing is, when I do get a pet that has environmental allergies, I really prefer them to be on a prescription hypoallergenic diet in case there is any crossover. And again, with me not wanting these pets on a lot of
Yeah.
medications, if I can keep them under control largely by diet, I would much
Right.
rather do that.
And that's easier for the pet owner.
Right. But I will tell you, the case that comes to mind about recurrent ear infections, I had another chocolate lab, like I'd mentioned earlier, that had recurrent ear infections, and the owner had a food allergic child. So she was wonderful. We put the dog on a prescription venison diet because he
Yeah.
had never eaten venison before, and he did great. Not another ear infection ever. So, in dogs and in cats, recurrent ear infections can be due to food allergy or environmental allergy, and you just don't know which. It's easy to start with the 8 weeks of the special prescription hypoallergenic diet trial
Yeah.
and see how much better the pet gets. Because if they do great, good. As an allergist, I don't have to go then and test them for environmental stuff.
Well, and also as a pet owner, you have to remember, like while you're feeding the special diet to the dog, the special kibble, you also have to remember to think about the treats and stuff too.
Yeah, you can't
You
have
can't
that.
have that. Like you have to use the
No
kibble
treats,
as the
bones,
treat.
rawhides, figures, nothing.
Yeah. Yeah.
We would just either use the canned or dry version of the same diet.
Hmm.
And for me, for treats for my dog, I just use their dry kibble.
Right.
I don't buy special treats. It's just easier for me to put a handful of dry kibble in my pocket
Yeah.
than to go out and buy a special treat. And I will say, some dog treats have as many calories as a Snickers bar.
No.
People, yes, people don't realize that. If you're on a weight control diet, you really do need, even in humans, to watch the treats.
Really?
Yes,
Okay, we buy,
absolutely.
and Libby's a big dog, but we buy those teeny tiny milk bones, the little ones,
Hmm.
which I'm sure,
Hmm.
she probably feels like she's getting gypped, but
Yeah.
we just use those because they're convenient. But we could use her kibble. She loves her kibble.
I have a wonderful story to tell you. When we were taking Tawny, one of our dogs who's since passed away, she was a rescue from Golden Treasures Rescue. We were taking her to Florida. So Mr. Jeromin bought treats for the dogs because, oh, they're traveling and blah, blah, blah. So we're in Florida and she's getting these treats and she's peeing all the time. So, of course, I call my girlfriend in Sarasota, who's an internal medicine specialist. We go there. We do blood work, ultrasound, x-rays, everything. They couldn't find anything. And I thought to myself, what's the only different thing that we've done here? It was the treats. And do you know those treats were so high in sodium that she was drinking all this water and it was going right through her. So thank God nothing was wrong with her. But imagine, I mean, my internal medicine friend, I mean, she did all this at cost. But what I thought to myself was, gosh, a regular pet owner,
Yeah.
this would have been thousands of dollars
Yep.
when the offending agent was the treat.
Was the
So
2.99
that's kind
treat.
of enough, right? Well, that's kind of another reason why I just give my dog
Yeah.
food as
Because it's
treats.
consistent. So Mr. Jeromin
Yes.
is no longer allowed in the treat aisle. The pet
Well, he's
food, yeah.
constantly reminded of the time he bought those treats and caused all those problems for Miss Tawny.
Well, I
Yeah.
do have, this is kind of funny. We have an air popper for the, like from college. It's not from college, but
Yes.
it's the air popper popcorn machine. The minute Libby hears that woo, when you plug it in the hot air, she
Oh,
comes
yeah.
flying because accidentally some of it ends up on the floor.
Well, here's what I want to know.
And it just
How
pops.
do my dogs hear when I'm peeling a banana and they're way upstairs or I'm in the other room? I'm still amazed by that.
I don't know, but they know.
Peeling, peeling a banana can't be very many decibels.
No. But for us, it's the popcorn machine.
Okay, got
Makes her
that. Right,
nuts.
right, right.
And, it just falls on the floor.
Oh, that's so
It's
cute.
so cute.
That's so
She
cute.
just loves it. Okay, so I think we have to like wrap it up for today, right?
I
So
think we do. And thank you so much for all the great questions. I hope that this helps give some insight into people's pets with their allergies. We'll do another show on allergies. And also, I think we'll probably do some shows that feature certain problems of certain breeds of
ooh,
dogs
okay,
and breeds of cats because we get asked about that a lot too.
sure.
I've often said you could do flashcards with some of our guests, like you name a breed and I'll name you
Dalmatian.
Dalmatian urate stones.
There you go.
They get bladder stones that are made of uric acid that like gout. Okay, do another one.
Uh, Dachshund.
Oh, I knew you said intravertebral disc disease and sterile paniculitis, where they have an autoimmune disease where their fat in under their skin starts to leak out like oil.
I'm gonna get a T-shirt with that across it. And see who can pronounce that one. I remember when you were studying for the boards, and I had to like ask you questions, and you'd be like, "I can finish. I got it." Like because by the time I
I
was seeing the
know.
flashcard,
Oh,
it's
those were the
just
days.
not
Those
my
were the days.
lingo. Just not my lingo. But that'd be fun to do. That'd be good. That's a good one.
Yeah, it's like veterinary flashcards. Veterinary, you name the breed, I'll give you the disease.
It's
And
name that
it's like
tune.
what?
Name that tune. Name that breed.
Oh, I know. I know.
Well,
Well, listen, I think we should wrap it up for
I
today.
do too.
So, Janet, it's been fun.
Been fun.
And yes, and please give Libby a big smooch for me and also those
I
cats.
will. I can't
And
catch the
I
cats
guess
though.
so. What did you
I
say?
can't catch the cats. They don't
I
really.
know you can't. I
They're,
know.
they're like
Ah.
crazy. Yeah.
Okay, so listen, this is Dr. Alice Novotny Jeromin and
Janet Novotny King saying thanks for listening. Don't forget to like, review, and share us because we want to be popular. Thank you.
we'll see you next time. Kiss the pets for us.
Bye all.
Bye-bye. Hey, thanks for tuning in today. We hope you found the science-based information provided helpful in taking care of your pet. Check out our other Speaking of Pets episodes wherever you get your podcasts.
We'd love to hear from you. So email your pet photos and or pet peeves to contact@speakingofpetspod.com. Remember to follow Speaking of Pets on all social media.